All right, good morning, everyone. I'm Hartford HealthCare's Tina Verona. Thank you so much for joining us today. Just a little bit of a change in schedule for today. I know we had mentioned at the end of yesterday's briefing that we would have Dr. Dimitris Bertsimis with us from MIT today. He will be joining us tomorrow for tomorrow's media briefing. So today I have the pleasure alongside me. First is Dr. Ajay Kumar, our Chief Clinical Officer here at Hartford HealthCare, along with Dr. Ulysses Wu, our Chief of Infectious Diseases, Chief Epidemiologist here at Hartford HealthCare. And we also have the honor of having Dr. Eric Walsh. He's the Medical Director of Hartford HealthCare Go Health Urgent Care to give us a status update on all of the urgent care centers across the state of Connecticut. But first, we're going to open things up with Dr. Kumar for the latest data across Hartford HealthCare. Thanks, everyone.
Good morning, everybody. I hope everybody's doing well. I'd like to go over the numbers of patients who are admitted with COVID diagnosis in Hartford HealthCare, but I do want to stress a point here. You know, we've been looking at our data very closely and across the system and evaluating every single patient to make sure that we understand the reason for admission, why the patients are in the hospital. And we have realized that almost about 30% of the patients who come to the hospital at the moment with a diagnosis of COVID are presenting with some unrelated illness. They're presenting with fall or heart issue or something else which is not related to COVID. So when we talk about the numbers, I want to make sure that context is understood by everybody. We do have 522 patients across the Hartford HealthCare, but as I said, 30% of them are generally related to non-COVID reason. In Bacchus Hospital, we have 49 patients. Charlotte Hungerford has 41 patients. Hartford Hospital has 213 patients. As a reminder, back in April 20th of 2020, we had 211 patients in Hartford Hospital who were COVID positive. Midstate Medical Center has 42 patients. Natchag has 10 patients. St. Vincent Medical Center has 74 patients. Hospital Center Connecticut has 77 patients, and Wyndham Hospital has 16 patients. 16. We have 45 patients who are COVID positive are on vent. And 64 of total number of COVID positive patients are on ICU at this time. There's no patient who's in ICU. There's no patient who's boosted is in ICU requiring ventilation support at this time here. So the data as presented, the numbers as presented needs to be taken into account that many of our patients are coming for unrelated reason, fall, and they happen to have a COVID. And Dr. Wu will go in some details later on, but we expect that to happen as community spread of Omicron is widespread. We would see patients actually who do have asymptomatic or mild disease. They may not even know that they have COVID, but they have unrelated reason requiring a hospitalization. With that, I'm going to pass back to Tina, and I'm sure there'll be some conversation around this question.
Sure. Dr. Wu, do you want to kind of pick up where Dr. Kumar left off and give us the latest update from an epidemiological standpoint?
Yeah, I think Dr. Kumar actually summed it up very nicely. And so we still anticipate that cases will begin to rise because when you have such a sheer number of Omicron, you would expect a little bit of flow over into the hospitalization. But Dr. Kumar is absolutely right. Even though the COVID positive percentage of people in the hospitals seems high, most of them are presenting, I shouldn't say most of them, some of them are presenting for other reasons. And so it is somewhat of a false number, but we are certainly following those patients and making sure that they don't develop COVID complications. But as I've always said in the beginning, what we've looked at is not just the percent positivity, which still hovers probably around 23% from this past weekend, but we're looking at it in relation to hospitalizations and as well as the ICU and ventilator data. And as Dr. Kumar has pointed out in previous media briefings, that ICU and ventilator data is much lower than last year. So I would expect that cases should start hopefully decreasing by January 15th, and then hopefully hospitalizations would follow thereafter around January 21st. Again, a lot of this is dependent on Omicron right now. One bit of good news that we are seeing is that for some reason, influenza within our own health system, as well as across the states, across the hospitals across the state, seems to be decreasing to a certain extent as well. And as far as I know, there have been, I don't want to say only 2 deaths, but there have been 2 deaths for influenza in the state up to this point, but hospitalizations are actually decreasing for influenza. So that is a bit of good news. I don't know exactly why, maybe possibly due to more people masking after the holidays, social distancing, all of those lovely things that we've always preached at this point. I'll end it there.
All right, thank you, Dr. Wu. I do want to ask one question before we get to Dr. Walsh. There's reports coming out that New York may have passed the peak in Omicron surge that some of their data is suggesting. Is that what, and how would that affect us here, especially in Fairfield County and here in Connecticut?
You want me to
go?
Yeah, go ahead.
I was watching you, Ulysses. Tina, let me take a shot at that, and I'll welcome Ulysses' comment as well. We would have a really extensive discussion when Professor Dimitri joins us next time. However, we do lag behind New York a little bit, so that's one of the reasons we still expect the peak to come in Hartford, in at least in Connecticut. And as we've talked about it between Ulysses and I, we've had some slight few days of difference in opinion here. I expected the peak to occur this week, but I think Ulysses said it may take a little longer than that. So we'll have a discussion around that. But I think we are seeing still increase in COVID patients and prevalence in Connecticut. And I think we've got a few more days to go before we can see that true reaching the peak here.
Yeah, I agree. I think we're actually in alignment because we're talking around that January 15th to January 21st window. Yeah. And we have to take into account which peak are we talking about, cases or hospitalizations. I think the hospitalizations will fall a little bit later, cases hopefully. But Dr. Kumar is absolutely right. Just like we tend to lag the UK by a few months, we also lag New York by 1 to 2 weeks as well. So if they are indeed falling off, you know, I guessed the college championship correctly yesterday. So I'm on a roll right now. So I did pick Georgia to win. So I'm hoping that we're right with our predictions. But New York is that, well, I shouldn't say canary in a coal mine because that indicates a bad thing. It's the alive canary in a coal mine in the sense that if their cases are dropping, then we should follow suit soon.
All right, thank you both for answering that question. Before I do get to reporter questions, I see one from Alex already in the chat. I do want to give Dr. Walsh an opportunity to give us the latest in terms of what is happening and what we're seeing across our urgent care centers. I know that you've been quite busy, Dr. Walsh.
Yes, thanks for having me. We have been very busy, but honestly, it's overall been a good thing. We have been able to really serve the community, and there are a lot of people who really require these tests to get back to work or to school. So we've been very happy to be able to supply these tests. We are seeing on a daily basis in the Go Health Urgent Care, Hartford Healthcare system, 1,800 to 2,000 patients a day, doing up to 1,000 tests a day. Some days more tests than that. We've watched the PCR tests go from taking 7 days to come back. That this weekend, actually, we swabbed someone on their way to Thailand, and they got the results back on Sunday, and were able to make their plane in JFK. So we see some trends happening with the testing. Our positivity rate over the last 3 weeks has been 16% positivity rate, which for us, we do not see the peak yet. Day over day, as we look at our positivity rates, they still are climbing in the urgent care centers. But I think the climb is slowing, which I think is important. So I would agree with what was said earlier that probably we're looking at a peak coming up here relatively soon. And so our doors are open. You know, our centers are still seeing all those patients. If people want to be seen, the best way is to go online and make an appointment a day or two in advance, and that way they can just come in and be tested and have much less of a time trying to get in.
Dr. Walsh, thank you for that. I'm sure you're going to be getting lots of questions. And just to clarify for our audience, Go Health Urgent Care has how many centers across the state?
We have 19.
Thank you. All right, we're going to open it up to questions now. The first one comes from Alex Putterman at the Hartford Courant. Last week, Dr. Kumar said about 30% of cases at Hartford HealthCare were incidental. Has that changed in either direction? Do you have an updated figure? Thanks, Alex.
Alex, no, it's still 30%. You know, we've done an analysis in the entire system right now, and it's still coming up to about 30% or so. That's the number where we are right now.
Jordan Fenster, Hearst, Connecticut Media. We're actually hearing that hospitalization statewide will be down for the day. To what do you attribute that decrease to?
Jordan, I'm not aware exactly what is mean by down by the day or for a day or for the day. As indicated earlier on, we're still seeing incline at the moment, the numbers of hospitalization and rising. And I think the nuance we need to know that incidental numbers of patients who are coming to the hospital will rise to a certain extent as large amount of Connecticut residents either get exposed or have some sort of a Omicron who are unvaccinated especially. We expect that the incidental numbers will go up, but total number of hospitalization among the people who actually have a COVID possible positive diagnosis may go up a little bit more at this time.
Follow-up question. Go ahead.
Oh, sorry, just to confirm that. So I guess, Jordan, it depends which patients we're talking about. The overall hospitalizations going from January 9th to January 10th are certainly down by about 158. But Dr. Kumar is absolutely right. We are plus 31 from that same time period for COVID positive patients. But we tend not to look from day to day, but we do look at 1 week averages and 2 week averages. And so once we see a sustainable trend, which we suspect, like I said, will be in a couple of days, well, maybe 10 days, then we can say that that we are maintaining that trend at this point. Sorry.
No, thank you for that. Alex, follow-up question from Alex. What types of masks would you recommend Connecticut residents wear? What are the pros and cons of cloth masks, surgical masks, and N95 masks? Dr. Wu, do you want to begin there?
Oh boy, where to start with that? And so, the issue with cloth masks is that they're probably the most comfortable and probably the most widely utilized, but the problem is that they're thin, especially the single layer ones, and we don't expect much protection from Omicron. Now, I'm going to put in the caveat that this is what I'm talking about indoors. Outdoors transmission is much less common at this point. So indoor transmission, I'm not recommending cloth masks. Now, surgical masks are still the standard. Now, why do we wear surgical masks? Because we believe that the majority of COVID is what we say, these big droplets that, don't hang in the air. And so these surgical masks should work. The problem is how much do we know is aerosolized? So they go into these smaller droplets that tend to hang in the air much longer, which is why you use N95s. But the surgical masks are most readily accessible and, if worn properly, should protect you. N95s certainly offer you that level of protection in terms of the aerosolization. The problem is that it doesn't fit everybody correctly, and it also has to be fitted. So for those of you who may have facial hair or different fitting faces, if you don't get that tight seal, it may not actually work as well. Finally, with N95s, they tend to be uncomfortable, and so compliance with using them throughout the day, if you have to wear them for extended periods, may be a little bit less. So there are pros and cons to everything, but to generally say a surgical procedural mask should be fine if it fits firmly around your face. Try saying that 5 times fast.
You said it well the first time. Kate Perkins from Connecticut Public Radio, thanks for joining. Her question is, are you concerned about state data showing the proportion of vaccinated people who are hospitalized rose from about 25% to 30% over the course of this surge? Does your own data reflect this, and what could explain this?
Go ahead.
Well, I'm not surprised. As the prevalence in the community goes up and as people seek care for a variety of reasons, their vaccinated individuals are coming to the hospital who may have COVID, are also coming for different reasons. They're seeking care as needed. So I'm not surprised by that number. And also, second factor is that there are still a fair amount of individuals who have not received boosters. So that decline in immunity can lead to exposure and positive cases as well. So it's not a concern. It's a reminder the boosters are important and folks should get the boosters.
Yeah, I would just second all that. And so I would point back to when we first started tracking this back in August. Guess what our percentage of people who are vaccinated that were hospitalized? It was 32%. So it does actually go up and down. So we've ranged anywhere from 20 to 32%. But I think Dr. Kumar's point about being boosted is very important because there's the clinical definition of what we say fully vaccinated. And that is your full vaccination series and if greater than 6 months, boosted. But the CDC definition and what is reported is you just need to be fully vaccinated with your primary series. And so even though they may be quote unquote fully vaccinated, if they're not boosted, we expect to see some flow over into the hospitalization.
Follow-up question from Jordan at Hearst Connecticut Media. We are hearing that some hospital systems are allowing doctors and nurses to work if they are COVID positive. Can you please let me know if that is happening at Hartford HealthCare? Dr. Kumar, do you want to begin with that one?
That's a interesting question. So, no, I'm sorry, I was a little distracted. No, we are not allowing patients, actually people who are positive, to come to Hartford HealthCare. We have a return to work policy as a conventional form, in the sense that if somebody's positive, they're out, they get tested in 5 days' time. If they're negative, they come back on 7th day. If they're positive, then we obviously follow the CDC's guidance on quarantine for 10 days before they come back. So we're not expecting our colleagues who are working way too hard right now to come back when they're COVID positive to work in the Hartford HealthCare.
Our next question is for Dr. Walsh from Tracy O'Shaughnessy at the Waterbury Republican American. Can you compare how many patients you are treating now at your 19 centers to how many you usually see in a week? And then there's another question, but we'll have you answer that one first. Dr. Walsh?
I think he may have fallen off.
I think he may have fallen off. Well, Tracy, we're going to come back to your questions. There is another question for Dr. Kumar from Tracy. If 30% of people coming into the hospital are incidental findings, can we extrapolate that to the public at large? In other words, are far more people in the public infected and do not know it? Asymptomatic people.
Tracy, is a possibility, given how many folks are getting testing and some of the data reporting because of the home testing may be lagging. There's a good possibility on that part here. But I think whenever we have this media discussions here, I do want to stress sometimes the data can confuse people more than reassure people. And I think the most important point to mention, if you were to report on this talking point here, the focus on boosters and completing vaccination. I think that's the most important thing to talk about, following the precautions at this time, wearing a mask and all that. I wouldn't want public to be panic thinking that they've got far too many people hanging around in Connecticut who are positive that can send a wrong message here. So I just want to make sure we're cautious about how we discuss these critical topics.
Thanks, Dr. Kumar. I'm going to get back to Tracy's earlier questions directed to Dr. Walsh. Can you compare how many patients you are treating now at your 19 centers to how many you usually see in a week?
You know, it's difficult to compare because the pandemic is skewed thing. If we went back pre-COVID, it'd probably be about we're probably up over, about 40% higher than we would be. This is typically the busiest season, the cold and flu season. So post-holidays, January, February into March. But our busiest month last year was the month of August. And that had to do with the surge that we had at that time. So we're probably, over last January, we're probably around the same right now, week over week, maybe a little higher. But I think we're able to absorb it best we can right now. And so it seems like we're kind of holding still, and I think we're going to be busy for the next few months at least in the urgent care world.
And a second question to you, Dr. Walsh from Tracy. You mentioned that results for PCR are having a faster turnaround. You saw a 7-day return rate that you mentioned. What are you seeing right now?
Like I said, I've seen as quickly as 2 days, but we tell patients 3 to 5 days. So if they're traveling, they've got to plan on that. There are some places in the state and in town where you can get rapid PCR tests. But we send out to Quest, and the turnaround time, we would tell people right now is about 3 to 5 days.
Jordan has a follow-up question. If people have the ability to get them, how many at-home testing kits should they keep at home? Where's the line between stockpiling responsibly and hoarding?
I'll try and take a shot at that. Stockpiling anything is not a good idea for the community at large. So that would be a basic statement. I think folks should have 1 or 2 kits if you're able to get handle on that, and use it wisely. Panic is not a good answer for a situation we're dealing with right now. The judicious uses of the resource is the most important thing. So please don't stockpile.
Next question comes from Mike Savino, WFSB Channel 3. Given that 30% of hospitalizations are incident, can you tell us anything about the true prevalence of COVID in the community? Do you feel that tracks with the positivity rate, or could that be a sign that COVID is more prevalent?
Go ahead.
Let's just carry on.
Yeah, no, it's just one marker. When we look at the overall prevalence, we have to take into account many different things. So hospitalizations is just one marker, and it tells us, maybe what is more Delta, what is more Omicron. Are some of these people who are showing up for other reasons and testing positive, is that Omicron, or the sicker ones Delta? But then we try to extrapolate and we take in other points of data. So that other point of data would be the percent positivity rate, which, like I said, is probably around 23%. But even then, we know that that is not accurate because not everybody is testing. But it also depends on the denominator, how many people are testing. So that affects the positivity rate as well. So knowing that not everybody is testing and that there are positive people out there, it's difficult to extrapolate. But what we have is a trend. And so when we look at the trend of the numbers over the past 2 years, we can get a general sense when we take into account that positivity rate, when we take into account hospitalization rate as well.
Second question from Mike. What are you seeing with demand for boosters? Has Omicron led to any kind of sustained increase?
Yes, we have seen increased demand for boosters and sustained increase as well. So answer is yes for both of them.
Alex from the Hartford Current. To what extent should Connecticut residents be worried about long COVID? What role should long COVID have in a discussion of the risks of COVID? Do you think of it as a major consideration or more like a rare side effect?
Hartford HealthCare is managing more than 1,000 patients right now who have long COVID in our system, who are seeking care through our outpatient network and long COVID clinic at this time. It always is a concern. We are still learning about the Omicron affecting long COVID, but with Delta, we saw a fair amount of long COVID syndromes, and with Alpha as well. So it's always a consideration, it's always a concern, and we got to keep an eye on that as we go forward.
Follow-up question from Tracy to you, Dr. Kumar. Following up on your point, in what way then do you think that the booster is playing a part in infections in the state? How do you see the booster playing a part in your admissions?
But Tracy, the boosters are not contributing to infections. The boosters are preventing individuals to getting moderately severe disease or requiring hospitalization. Those individuals who have boosters have generally a very good outcome, even if they get admitted to the hospital in terms of mortality. So the boosters are a good thing. And as I mentioned, we have 0 patients who is intubated right now with boosters, despite more than 500 patients in the system with COVID. So boosters are highly encouraged at the moment for preventing a severe illness. I think, how do you see the booster playing a part in the admission? Boosters are helping to reduce the number of admissions at this time. Very few, I think 3% only individuals who are in the Hartford HealthCare who have boosters are admitted at the moment.
Follow-up question from Kay at Connecticut Public Radio. Has your requirement for 7-day isolation for workers who have an exposure contributed to staffing shortages at all? Dr. Kumar, do you want to take that?
The impact, Kay, we are seeing among the staffing is noticeable, but we are thankful in Hartford HealthCare with such a large integrated healthcare system to help each other out as well. And I must acknowledge that our team members, our colleagues across the Hartford HealthCare are working extra. They're working multiple shifts. Normally they wouldn't pick up. And many of the administrative leadership and the physicians and other members are supports finance, IT, everybody's contributing to the patient's care right now to make sure they're helping with transport of food or whatever else is needed at the moment. And this is really the most impressive part about the culture in Hartford HealthCare. And I would imagine many other healthcare systems are doing the same thing. I'm just speaking on behalf of Hartford HealthCare at this time.
We do have a question from a Facebook viewer. Are tests that are not FDA approved bad? That comes from Diane via our Facebook page.
I can probably answer that. I wouldn't say bad. I wouldn't use the term bad at all. And it depends what regulatory agency has approved what. For example, the WHO and the CDC, they've approved certain vaccines while others have not necessarily approved vaccines. All I would say is every test is as good as its purpose. So it really depends what your purpose of that test is. If your purpose of that test is because you want to go visit a loved one and you are sick and you take the test and it ends up being negative, that could be a bad test. And so it depends what your purpose of taking the test is. So reliability is very dependent on what you need to use it for. So I'm not going to say it's bad, but if you have high suspicion you have COVID, I would definitely recommend getting an FDA approved test or go seeing our colleagues at our Go Health centers.
And
Dr.
just,
Dr. Walsh, anything to add?
yeah, I would only chime in that a lot of people ask us about the tests, and the antigen tests are very useful for kind of regular weekly checks, or as Dr. Wu said, before going to see relatives, so forth. The rapid test we do in center is an Abbott ID Now molecular NAAT, nucleic acid amplification test. That is actually very accurate, just a few points less accurate than a PCR test. So we do recommend for people who, for whatever reason, they really need an accurate test fast, that they use one of those tests because it is a fast way to get a very good result.
Next question comes from Jordan. The state has asked nursing homes to accept COVID positive admissions from hospitals. Is that shift in policy affecting hospitalization numbers? How many COVID positive patients are being sent to nursing homes? Dr. Kumar, do you want to start with that?
I think that nursing homes across the state, as best I know, are finding the same challenges right now with the staffing and a spread of COVID as well. So I know the nursing homes are doing the best they can do to accommodate the needs at the moment. We have, I don't actually have a number of COVID patients who are sent to nursing homes. A great question, Jordan. I should find out in our system. But we do have some delays in transitions of those patients who have been waiting for SNF beds because of the staffing challenges, and we're monitoring it very carefully. Right now, the system seems to be backlogged because the staffing issue is affecting pretty much every single sector of our industry right now.
Next question from Tracy to Dr. Walsh. Can you explain why your positivity rate is 16%, which is lower than the state's positivity rate? Is that something to do with the purpose of urgent care centers?
That's a great question. And actually, we discussed this amongst ourselves when we were discussing the data yesterday. What it is that the data range is an average, and it precedes the surge, which began around December 8th or 9th of last year. So I think we were taking into account a few weeks that probably preceded the surge. I think if we looked at the positivity rate over the last 2 weeks, it would be higher. So I think it has a little bit to do with that. On the question of the purpose of the urgent cares, I mean, our job really is to get people tests, and to me, from a public health standpoint, so that people are not exposing other people, so they know they have it. Especially when it comes to those who are going into delicate situations where you don't want someone to get it. And for that reason, our purpose works very well. And we do sometimes get a lot more negatives than we would otherwise get. There are a lot of people who come to get tests from us just in case and just to be sure, without symptoms and without even known exposures.
Next question from Kay. What is the impact of staffing shortages on performance, morale, retention?
I'll take that, Kay. The impact on staffing, given the COVID exposures and disease right now, it definitely has the impact on morale just as much as it has a morale impact on the rest of the community and rest of the society right now. I think everybody's a bit tired of pandemic right now. But what's most important to highlight that safety is always our cornerstone of working in Hartford HealthCare. And we do make sure that the safe care is provided to every single patient who interacts with the system. So performance is not a concern I have right now. I do worry about morale in general, for everybody in our society right now. We haven't had a concern about retention in Hartford HealthCare. In fact, we've added more colleagues in pandemic time than before. in recent past because we continue to hire and have individuals join Hartford HealthCare. Resiliency of this staff, the colleagues across the Hartford HealthCare is very impressive. And I do want to highlight that the folks are working very hard at this time, but they're providing the care with safety in mind, and safety remains a core principle at this time.
I know we did go over the numbers at the beginning, but Mike is asking, I think he may have joined late. So if we could just go over those again, how many patients are intubated, and breakdown of unvaccinated versus vaccinated, but not boosted.
Mike, we have 45 patients who are with COVID intubated in Hartford HealthCare across the system right now. Majority of them are unvaccinated. I don't actually think I have the number right in front of me on those unvaccinated.
I can break it out if you need.
Yeah, if you don't mind.
Yeah, absolutely. So 196 of the total 400, this is to answer all of your questions, Mike. If we had 465 patients, this was yesterday's data, 196 were vaccinated, 14 were boosted. So a very small percentage in the hospital were actually boosted. I don't have the system-wide in terms of the 45 people who are vented, but at Hartford Hospital, when we had 16 patients yesterday, 0 were boosted. So, and only 3 were vaccinated. So it shows that vaccination and boosting works again.
Then again, sticking with the numbers, any numbers on whether we're seeing fewer breakthrough infections among fully boosted individuals?
Yes, answer is yes, Tracy. The boosters provide a lot of protection, and I would advise individuals to get boosters.
Kay from Connecticut Public Radio, do you have a comment on the recent message from the World Health Organization that repeated boosters are not a viable long-term strategy, calling for a better vaccine?
Yeah, ideally, no vaccines, no boosters would be great. If this illness would just go away or turn into the common cold. But I can't say that boosters are not a viable long-term strategy, but I do understand their statement, because with every booster, with every shot, you're going to have drop off in terms of the percentages of people that are accepting. So for example, for all of the people who had the primary series of the vaccine, we can't say we had 100% flow over into boosters as well. And so, yes, it's probably not a viable long-term strategy, but that still doesn't mean that we shouldn't be looking for a better vaccine. And we have to be very careful in the sense that it makes it almost seem like the current strategy is not good. I mean, in the span of 2 years, some incredible, miraculous changes in science have gotten us to this point. And we are looking at lives saved. We are looking at decrease in hospitalizations and morbidity and mortality based on the science that is there, the vaccines that are out right now. So I don't want to, I guess I don't want to look a gift horse in the mouth and say, our current vaccines, they're just all right. They're really darn good. They really are good. Could we do better? Absolutely.
And one final question from Kay. Have numbers of workers leaving Hartford HealthCare increased recently compared to pre-pandemic or earlier pandemic?
It's a complicated question, but let me try to explain as best I can, actually. I think we have seen a departure from workforce in all industries right now. So in same fashion, I think every industry has been affected to a certain extent. In Hartford HealthCare, the few data points, we've actually had expanded care in St. Vincent area. We built a new building in Hartford region, which is staffing new patients and more patients right now. So overall, we've added more colleagues in Hartford HealthCare than leaving in pandemic time. And as we continue to expand in our providing access to our Go Health or primary care network or our outpatient surgery centers, we've continuously seen a growth in number of colleagues joining Hartford HealthCare. But it's something we watch very carefully. Of course, what's happening in our society, in our country right now, with great resignation and other things which are changing, it does create a concern for all of us right now. But at least we've been fortunate in Hartford HealthCare to be able to maintain the staffing level required to provide safe care to our patients and community.
Right, I don't see any other questions in our chat. Great questions from the media today, as well as our viewers on Facebook. As you all know, I always like to end with final thoughts from our panel. So Dr. Wu, let's start with you. Final thoughts for today.
I'd like to thank everybody for coming here, and I'd like to thank Eric Walsh for coming here as well. Great to have him on and talk about, because he's his staff is on the front lines, and it really I really appreciate everything that they do. From our standpoint, we are hoping that our predictions stay true. We are hoping that the numbers will drop. We have been taught a lesson in the sense that instead of looking at the percent positives within the hospital, because we know a lot of them are in the hospitals for different reasons, and that may be because Omicron is more mild. Rather than looking at, I shouldn't say the percentage, but the absolute number of positive COVIDs, we need to look and risk stratify those who are positive here for COVID and here for COVID reasons alone. And once you start teasing out those numbers, I mean, it still looks not as great as where we would want it to be, but it doesn't look as bad. So I think those numbers are going to get better. And I suspect Dr. Kumar will say the same, but I'll pass it on to whoever's next.
There is hope on the horizon. Thank you, Dr. Wu. And Dr. Walsh, we know that you're extremely busy, as all of our panelists are, so we thank you for coming on today. Any final thoughts from urgent care?
Yeah, I want to echo something that Dr. Kumar said, which I think is really important. And he used the word resiliency. I've been a part of a lot of healthcare organizations in my career. I'm very proud to be a part of Hartford HealthCare's, the team, the support we get on the ground level, and even you just hearing Dr. Wu give us some props is really, really encouraging. It is not easy to go in day out and see lots and lots and lots of patients who need these tests. But I have to say, it's really wonderful being part of a team where we are not just testing people. We know that we have a system in place where patients can go and get treated for COVID and get exemplary world-class care. And that, I think, inspires our staff. We know that it's more than just a job right now. I mean, we really are on the forefront of history. And one day we'll be able to look back and talk about what we did in the middle of a crisis to improve our society and to better mankind. And for that, I think I'm grateful. And I think that's why the numbers of staff we have actually have increased rather than decreased. I think that's why our patients' loyalty hasn't gone up in our urgent care centers. And I think that's why we can have hope that this thing is going to end, because I think we stuck it out. We fought together, and we're seeing our community really pull together. And it's really been a beautiful thing.
Dr. Walsh, thank you for joining us today, and thank you to all of the teams out there across the 19 centers, urgent care centers across the state of Connecticut, on the front lines, day in and day out, making sure that people get tested. We appreciate all of your efforts, to you and the team, so thank you. And final thoughts from Dr. Kumar. Thank you,
Tina. I just want to tag on to what Eric said a few minutes ago. Really important to know the contrast from the first surge we had of COVID back in 2020 to where we are right now. If all of us remember the first time we were focused on what the hospitals can create more capacity and accept more patients to manage those really high mortality related illness at that time without having any specific treatment options available. That was March 2020. I think all of us remember very well. Compared to now, right now, with multiple modalities of the treatments and vaccines and boosters and other things available, a large outpatient presence and know-how and the capability to manage those pandemic right now. We are in a different place of pandemic. So folks like Dr. Walsh and individuals in his team and a medical group are doing an amazing job to provide that outpatient access. Our supply of monoclonal antibody and Paxlovid and other things, we are managing COVID in the surge largely in outpatient setting and less so in inpatient setting at this time, comparatively right now, which is different than what it was in the first surge. So we are seeing a change in management of COVID, where hospitalization is partly incidental and partly related to COVID, especially those who are unvaccinated or not boosted, but majority of the care has been provided in outpatient setting right now for large amount of patients. So I just want to highlight this contrast in this phase of surge we are finding ourselves compared to the initial surge.
All right, that will conclude today's media briefing. We hope you can join us tomorrow, where we will have our special guest, Dr. Dimitris Bartzimis from MIT, who will be discussing more about predictions and modeling across the state here in Connecticut, and what that means for us. So do come prepared with your questions, and we look forward to seeing you all back here tomorrow. Take care.
Thank you.